We've continued to discuss the issues and concerns of the nursing home industry and the long-term care community with our folks at the Command Center, and have learned a tremendous amount about the current challenges that facilities continue to face when managing COVID-19. And today we're announcing new measures, including an additional $130 million available for nursing homes. This is the second round of $130 million, which comes on top of the $130 million that we announced on April 15th. We're also making additional assistance available to help address staffing shortages as well. The new funding will be made available on May 1st to help pay for more staff, implement state-of-the-art infection control, cleaning services, personal protective equipment, and other support services. These funds will be allocated to nursing homes that are meeting a benchmark for certain criteria to ensure these privately operated facilities are working as safely as possible. In addition, we're boosting additional assistance for temporary staff support, including clinical response teams of 120 nurses and certified nursing assistants that can be deployed in teams to facilities in emergency situations. On-the-ground crisis management support from experts, and deployment of the National Guard to help with logistical, environmental, and other support. This is in addition to the mobile testing services they're already providing. These new staffing resources will be available for all nursing homes. Our administrations work closely with the Massachusetts Senior Care Association to create a centralized infection control command center utilizing experts from Hebrew Senior Life and other providers. They will provide direct infection control support to facilities that need help. The Commonwealth's 386 nursing homes come in all shapes and sizes. They offer different levels of care and provide support for their residents in varying stages of health, all the way through to end-of-life care. Nursing homes have a pressing obligation to provide the best care they can for many of our most vulnerable and fragile residents. The introduction of any illness, but especially a virus like this, can be lethal for our elderly and challenging for staff and caretakers. This would be true for the flu or the common cold, but it's been significantly amplified by COVID-19. You've heard me refer before to COVID-19 as an invisible enemy, one that still has leading epidemiologists and infectious disease specialists struggling to understand it. And as I said earlier, our nursing homes have been hit especially hard. Once COVID-19 gets into a facility, it spreads rapidly and in many cases can be undetected for days. I'm sure you all recall that we talked earlier this year about a nursing home we tested that had no symptomatic COVID-19 residents, and with 98 tests, 51 of the 98 we tested came up positive. This requires everyone to be more vigilant about staff and other people working in these facilities. In many cases, staff interact with several residents daily to do their jobs. It makes controlling the disease that much harder, and it also demands a new level of infection control and staffing requirements for our nursing homes so that they can create the safest environment possible. This, of course, is not easy to do, but it's expected, required, and necessary. So with this new funding, we're also putting in place a set of mandatory criteria for nursing homes that operators must adhere to. Some of these requirements include testing all staff and residents for COVID-19, adherence to a 28-point infection control checklist based on Department of Public Health and CDC guidance, meeting PPE requirements, staff requirements, and clinical care requirements. Facilities will be audited to make sure they're meeting these requirements and providing the safest possible environment for some of our most vulnerable residents. Clearly, protecting our most vulnerable citizens in nursing homes, rest homes, and assisted living residents has emerged as among the greatest challenges we face in our fight against COVID-19. This highly contagious, invisible virus has proven to be most dangerous for people over the age of 70 and those with other pre-existing health conditions. This is complicated for facilities where several residents live in close quarters and require attentive care from their providers multiple times a day. This dangerous equation has now resulted in over half of the Commonwealth's COVID-19 deaths. But we will be as aggressive as we possibly can be, working with our colleagues in the long-term care industry to ensure that we're taking all the necessary precautions and providing the resources that are necessary to get this job done. We here in Massachusetts, as I said earlier in my remarks, are still in the surge and very much in the fight against COVID-19. Lieutenant Governor Polito and I continue to be inspired by the determination and perseverance we see from our residents and the commitment of our frontline healthcare workers and first responders who are out there doing the job every day in the fight. We also want to thank the nursing home staff that work diligently to care for some of our most vulnerable residents. And on this one, I can speak with personal experience, both for my mom, who fought Alzheimer's alongside my dad for 10 years, and for the care and support that's been provided to my 91-year-old father. I'd also specifically like to thank Tim Foley and the healthcare workers at 1199 for working with us to support nursing homes. We will keep the fight up all the way to the end, knowing that we'll come out the other side. There will be better times and brighter days.